Hello. Thank you for your interest in the University of Texas Oral and Maxillofacial Surgery program at Houston. My name is Mark Wong, and I'm the department chair, and I also serve as the program director of the department. In the next 30 minutes or so, I'm going to try to do something which we customarily do in person when candidates who are interested in our program are invited to interview and meet members of the department and to see firsthand what the Texas Medical Center and the program is all about. Unfortunately, in this day and age, we're having to do things through this remote sort of process. And so I'm going to try to convey to you all the important elements of the program, which I think you might find interesting if you are interested in coming to Houston to train. During this job fair, you're also going to have the opportunity to have chats with either faculty members or residents in the program. So I hope that after you've had a chance to view this video and the slide presentation, you'll take advantage of those opportunities. In addition, if you have additional questions that you would like to ask of anybody in person, we will also provide opportunities for you to be able to reach out and connect with different individuals, either through emails or through personal video conferences. So without more ado, in essence, when you are interviewing in Houston under the normal sort of time period, we would start the process off usually on a Sunday evening where we would get together with candidates who are going to interview with us the next day, and we tend to gather in one of the local watering holes, and we serve you a nice barbecue dinner, and you have an opportunity to mingle, with both residents and faculty the night before, and in an informal sort of setting. And then the next day itself, we begin the interview process and also conduct tours of the medical center. This year, because of the inability to have in-person interviews, we're going to have to try to just show you the program with static images and hopefully some video as we're trying to prepare a department summary video for release later on in August. So the department is based in the Texas Medical Center. This is the largest medical center in the world. And if we were to look at it from a numbers sort of standpoint, you can see that it sits on top of approximately 1,300 acres or so. The operating budget is in excess of $25 billion, and there are over 9,200 patient beds. The Texas Medical Center employs about 106,000 people, and there are about 10 million patient visits a year. And that's a lot of patients to essentially support a residency program. There are 54 institutions, and those institutions can be made up of either educational institutions, such as the University of Texas Medical School and Dental School, but they're also made up of hospitals that are part of the Texas Medical Center. And to fulfill the educational mission of the different institutions in the medical center, there are about 20,000 students enrolled. The Texas Medical Center is made up of essentially a number of institutions that are really part of a healthcare consortium. And some of the more significant members of this consortium include the University of Texas Health Science Center, which as a total health science center is made up of a number of individual schools, such as the University of Texas School of Dentistry, the University of Texas Medical School, the School of Public Health, a Graduate School of Biomedical Sciences. There's a School of Nursing, as well as a School of Informatics. Also part of the University of Texas system, but not part of the HSC, largely just because of its enormous size and its very special focus, is MD Anderson Cancer Center, which also sits in the medical center itself. One other medical school that is present and has actually been present in the Texas Medical Center long before UT had its own medical school is Baylor College of Medicine, a very, very renowned and established medical school. The University of Houston College of Medicine just opened its doors last year, and so there are actually 3 medical schools here in Houston alone. But there is only one dental school. And the significance of all of this lies in the fact that whilst there may be multiple departments of ENT or plastic surgery or general surgery, for instance, there is only one department of oral and maxillofacial surgery. And we serve the entire Texas Medical Center. And that accounts then for the size and also to some degree the complexity of running this program. So in addition to all of these, as we mentioned, there are other institutions such as a School of Pharmacy, and there are several nursing schools here that are also present in the Texas Medical Center. So the way that we organize the department is really based upon the different sorts of hospital affiliations that are tied to the different medical schools. So you'll see over here in red, the Baylor institutions, are responsible for covering Ben Taub General Hospital, which is one of the county hospitals. The VA Medical Center is also part of the Baylor system. And in years past, the Methodist Hospital, which is one of the largest private hospitals in the country itself, was the flagship teaching hospital for Baylor College of Medicine. Unfortunately, about 10 years ago, there was a dispute between the leadership of the two organizations. So the Methodist is essentially on its own and, in fact, has its own affiliations with medical schools in both New York, in Weill Cornell Medical School, as well as the University of Texas A&M system based out of College Station. But because of the fact that we have had a long-standing relationship with the Baylor system and Methodist Hospital, we continue to have a very strong presence in the Methodist Hospital, even though Baylor no longer does. You'll see that the University of Texas based hospitals are Memorial Hermann Hospital, LBJ, which is a second county hospital, and also the School of Dentistry. So these are the affiliations on the University of Texas side. And in addition to Methodist, we have a Shriners Hospital, which is a pediatric orthopedic and cleft facility, which we provide services to, and that's where our residents gain experience on a cleft team. So currently, as far as faculty members are concerned, we have 14 full-time faculty that cover all the various institutions that the residents will rotate to and the ones that we mentioned before. We have a part-time dental anesthesiologist who helps teach the undergraduate anesthesia courses, and we have 3 part-time OMS faculty. And these individuals are primarily involved, with the teaching of undergraduate dental students in the dental school, though when the residents rotate over to the dental school as part of their 3rd and 5th year rotations, they will be staffed by the same faculty. So most programs, as you will learn, in your interview process itself, are shaped by the different environments that the residents rotate to. So depending on where you rotate to, the types of cases and the involvement of the residents will vary. So for instance, all of our residents in the 3rd and the 5th year will rotate to the University of Texas Dental School. And there, whilst they are on their 2-month rotation, they'll be primarily involved in dental alveolar surgery, pre-prosthetic surgery. They'll place implants, and they'll be involved in outpatient anesthesia. They will also have experiences doing pre-orthodontic extractions, as well as exposed and bonds of impacted teeth. At the dental school as well, we have a rather unique sort of facility that was funded by our Alumni Association. And you'll see a picture of this down here, in which we actually have our own outpatient anesthesia simulation lab with a sim man. And the control room for the SimMan is sitting right next door. And every year, the residents from all the different services will have an exercise in which they come over with the various staff from that particular facility itself and run through a number of different anesthesia simulation emergencies. This is really to try to perfect the operator anesthetist model, which is something that a lot of individuals who go out in private practice will be employing. The dental school is also the place where the principal research laboratories for our faculty who are committed to research, and that's primarily Dr. Simon Young, and his laboratories are attached to the dental school here in the adjacent building. So the Methodist Hospital, one of the largest private hospitals in the country itself, and it's a facility that has a number of professional towers in which there are intramural offices. So our intramural practice is based here in Scurlock Tower, which is this building over here. And this is a outpatient clinic for all the different faculty members who participate in the intramural practice. So coming from this practice, and whilst the residents are on this rotation itself, will be a whole host of elective surgery types of cases, including orthodontics, TMJ, pathology, reconstruction, again, dental alveolar surgery, and some implant surgery. Memorial Hermann Hospital is actually an unusual sort of facility because it is, technically speaking, a private hospital, but it is also one of 2 level 1 trauma centers in the country. And as a result of which, and because the Life Flight helicopter is based out of Hermann Hospital, Memorial Hermann is a very, very busy urgent care facility with a lot of trauma, and from our perspective, also a lot of major head and neck infections. Memorial Hermann Hospital is therefore a facility that the residents get a tremendous amount of experience in the management of trauma, infections. They also do a lot of reconstruction, and we do our major head and neck surgery as well as our microvascular reconstructions in this facility. Hermann, as a private facility as well, is a place that we can do orthodontics as well and TMJ surgery. As far as the county hospital system is concerned, well, the Harris County Hospital District has 2 different county hospitals. Ben Taub General Hospital, which is sited in the medical center, is also a level 1 trauma center. And over there, you'll have trauma, reconstruction, pathology, infection. And, that is also interesting, a facility in which we have an orthodontist come down 1 day a month and help support the development of orthodontic cases for the residents in the county system. The Ben Taub is also a facility where we do oncology and reconstructive surgery. LBJ General Hospital is about 15 miles away from the medical center. So even though it has its affiliation to the TMC, it is geographically a little further away. There, again, it's a full scope hospital dealing with a lot of dental alveolar surgery. There's a significant amount of outpatient anesthesia that is done there as well. And the faculty there are involved in doing, a lot of pathology, a lot of reconstruction, and also oncology. As part of the Harris Health System, we have an oral surgery outpatient clinic called the Monroe Clinic. This is actually staffed by 2 individuals who are former graduates of our program, but who have been in private practice for about 25 years apiece. And so this is a very good facility for our PGY1 interns to be able to gain a lot of one-on-one training in dental alveolar surgery from individuals who are very, very practiced and experienced in this area. So all of our PGY1 residents will rotate to this facility and spend anywhere from 1 to 2 months, in the year itself, gaining experience, additional experience in learning how to take out teeth. The VA Medical Center is another part of our program. And over at the VA, there's a significant amount of dental alveolar surgery and outpatient anesthesia done, but it is also a facility that allows our faculty to train the residents in a very, very comprehensive implant dentistry. The VA system supports not only the oral surgery component, but also the prosthodontic component. And so the collaborations between these two different wings has allowed for a very strong, robust experience in implant surgery. And lastly, as we said, the Shriners Hospital, this is a facility for pediatric patients with orthopedic and craniofacial deformities. And our residents and Dr. Poseidi, who is part of the cleft team, will perform surgeries to repair alveolar clefts, as well as the orthodontic surgery that is part of the comprehensive treatment plan for many of these patients. It is also a facility that we are currently using for the pediatric anesthesia rotation, but we are potentially exploring other alternatives for that in the future. And our oncology and microvascular team, it's a very, very active team that does between 80 and 100 cases a year. We have 2 faculty who are credentialed for both the ablative and the reconstructive procedures themselves. At different times, we will have a fellow who will come in to learn how to do oncologic and microvascular procedures, but this is not a consistent sort of process. The oncology team works very, very well with our Baylor ENT colleagues, and in fact, the fellow is shared between the 2 different departments. And the facilities in the Texas Medical Center are really second to none. We have a wonderful surgical skills and simulation facilities that have been developed based out of the medical school. And in these facilities, we can use them for a number of different types of hands-on courses and dissection courses for the benefit of the residents. The program also has a very, very strong research and scholarly component, and this has been facilitated to a large degree by our close relationship with Rice University's Department of Bioengineering. In fact, the Rice University sits right next to the Texas Medical Center, and so geographically there are a lot of opportunities for us to be able to develop relationships with them. The different types of grants that we have had with them, which have spanned over the last 15 years or so, have been funded by a number of different sources, including the Armed Forces Institute of Regenerative Medicine, the NIH, and also our OMS Foundation. And we tend to focus in all of our different types of research activities with Rice in different tissue engineering sort of projects. And so we've been regenerating both bone, cartilage, and muscle through our collaborations. Now, these collaborations have also been very, very important because it's allowed us to develop a very strong record of scholarly works. And this has been of great advantage to us as we try to promote the program's name and reputation. And so some of the individuals you see pictured before you, Dr. Tony Mikos, who's a professor of bioengineering and one of the most renowned bioengineers in the country itself, Dr. Kerry Athanasio over here, who was formerly at Rice, and an individual that we did a lot of TMJ work with. He is now at the University of California in Irvine. This is Dr. Simon Young, who actually completed both an integrated OMS PhD and MD program. And Dr. Young is our director of research. And this is Dr. James Melville, who's one of our oncology faculty and also a prolific clinical researcher. A lot of the individuals who actually work with us in the lab itself are not necessarily our oral surgery residents because the level of work is very, very intense, and so these are individuals that come from the Baylor College of Medicine's MD PhD program. And so some examples of the number of articles and all that the department has been responsible for. This actually comes from 2 years ago. So in 2018, you saw that, we had essentially 16 different publications and journal articles, another 12 textbook chapters, And actually, that was a banner year for us because we actually were involved in the publication of 2 textbooks as well. One was a volume in the Oral and Maxillofacial Surgery Clinics of North America, and this one was a standalone textbook on regeneration strategies for reconstruction. Now, I know a lot of you are probably going to be interested to hear a little bit about, what the call structure of the program is. So because of the size of the program and the level of activity, all of our call is in-house call itself. Now, we have 2 different types of call. One, we share trauma call 1 and 3 with plastics and ENT throughout the medical center. And so when we are on trauma call, we will actually have 2 teams of residents in-house and a mid-level resident also in-house. So 3 residents in all covering a trauma call. On the nights that we are not on trauma call, we are on what is euphemistically called tooth call, but it really means everything that is other than trauma, and that's usually a lot of infections. So we will have 1 resident that covers the TMC, and because OBJ is 15 miles away, we have a second resident who is on float. So that means that individual does not stay in-house, but is available to travel up to OBJ should a patient present up there, and that way the TMC resident does not have to get into their cars and to drive up to OBJ in the middle of the night. So on average, because we have essentially 6 PGY categorical residents and 2 PGY1 non-categorical residents, intern call is between 5 to 6 calls per month. Mid-level call is about 2 to 4 calls per month, and chief residents will take about 5 calls per month, but their call is at home. Okay, so I'm going to spend a little bit of time now just talking a little bit about the different types of residency tracks that we have here on a full-time and on a part-time basis. So on a full-time basis, we actually run both an OMS integrated MD track program lasting 6 years. We also have an OMS certificate track lasting 4 years. But when we have the right candidate, and not every single year, we also have the option of offering an OMS PhD track. I won't say too much more about the PhD track at this time, but if there is any candidate who is interested in this, please reach out to me offline and we can certainly discuss it. So the OMS MD track is 6 years long, and individuals will spend 36 months on oral maxillofacial surgery services during this time. In the 4-year track, you will spend 34 months on oral and maxillofacial surgery. And for those of you who know what the training standards are, the Commission on Dental Accreditation requires that OMS trainees spend a minimum of 30 months in oral and maxillofacial surgery. So this is how the program is really broken out. And I'll start off with discussing the certificate program. You'll see that you will spend the first year, the PGY 1 year, 12 months entirely on oral and maxillofacial surgery. In your PGY 2 year, that is the year that individuals will do most of their off-service rotations. So this includes 3 months of internal medicine, in which you will be spending a month doing cardiology, a month doing pulmonology, and then a month on the general medicine consult service. You will then also do 4 months of anesthesia on the anesthesia service, and you do this as an anesthesia resident. You're treated just like an anesthesia resident. In the second year, you will spend 1 month doing neurosurgery, and you will rotate on neurosurgery over at Herman Hospital, where the residents have really enjoyed their rotation because they are really engaged in managing these patients both in the operating room as well as the neuro ICU. And for the remainder of the time in your second year, you will be back on the oral surgery service. In the PGY 3 year, you will spend 4 months doing general surgery, and then you will spend 1 month doing pediatric anesthesia. Currently, as we said before, that rotation is over at the Shriners Hospital, but because the hospital may be moving to Galveston, we are exploring different alternatives at the moment. And then for the remainder of your PGY 3-year, that's 7 months in all, you will be back on the oral and maxillofacial surgery service as a kind of a sub-chief. And in the final year, you will spend 12 months as an oral and maxillofacial surgery chief resident, rotating through the different major hospitals that are part of our program. If you are in the MD integrated program, your program outline is similar, though obviously you'll be going to medical school in the middle of it. So once again, you spend the entire first year on oral and maxillofacial surgery. And this has been a very important year for us because we find that during this time, you are able to bond not only with other residents in your group, but also with the faculty. And this kind of development of a relationship between us and you has been very important in establishing the connections, for you to continue with the program. In the second year, you move off to medical school in August. So you will spend not quite 2 months on OMS at the start, but probably closer to 6 weeks. In the second year of medical school, then, you will fulfill what is essentially the second year of medical school. So that's roughly 10 months. And at the end of that 10 months, you will sit your USMLE Step 1. This particular process, in which our students have had an entire year to prepare for Step 1, has been very, very useful because the students have all been very well prepared. And to date, since the program's inception in 1990, we have never had a resident fail Step 1 of the USMLE. And so that's been a great bonus. In the third year of the program, you are in the third year of medical school, and those are largely your clinical rotations. So we don't really see much of you, but you spend that time doing 12 months of mandatory clinical rotations. And then in the fourth year of medical school, which coincides with your PGY 4 year, and the same year that you will do Step 2 of USMLE, you'll notice that you are actually only in medical school for 4 months. There are only 4 months of mandatory medical school rotations. And the rest of the time, you are actually given back to the oral surgery service to fulfill those mandatory oral surgery rotations, as well as spend some time back on the oral surgery service. So the PGY 4 year over here, you'll see, is very similar to the PGY 2 year in the certificate program. You spend 4 months doing anesthesia, you spend 1 month doing neurosurgery, and 3 months doing oral surgery. Now, the fifth and the sixth year of the programs for those who are in the MD integrated track is kind of an interesting thing. And you'll see over here that I've marked it out in green. The reason I've done that is that because of our great relationships with our general surgery department, in the fifth and the sixth year of the programs, you are actually registered as general surgery residents and not as oral surgery residents. Now, why is this important? Well, all of you are familiar with the fact that for a number of states, you need to have at least a year of an ACGME accredited specialty to be able to an ACGME accredited specialty to be able to gain medical licensure. There are some states now who are requiring 2 years of an ACGME accredited training program. So in order for us to help our residents gain licensure, medical licensure, when they complete the program, we have actually arranged with general surgery for them to register the residents as general surgery residents and not as oral surgery residents. But at the same time, whilst they are in their general surgery years, they are still doing the same rotations that they would have done if they had been entirely with us. So you'll notice that the general surgery component of the PGY 5 year is only 4 months long, exactly the same as the certificate program. After which you will then do 1 month of pediatric anesthesia and spend 7 months back on service in oral surgery. And in the final year, obviously, you will be the OMS chief resident and spend the entire year, like your 4-year counterparts, doing oral surgery. And when you get to the final year, there is absolute parity between our 4-year and our 6-year residents. We treat them all exactly the same as chief residents. Okay, we have a very strong didactic program here in Houston, largely because of the significant number of faculty that we have with different areas of expertise, but also because we have a very large, resident population. And so here are some examples of morning conferences that we conduct in a formal manner 3 days a week. Now, whilst we used to do this in person at the beginning of the COVID era itself, we had to switch a little bit and do this all in a virtual sort of format, but we are still conducting this number of programs. So on Monday mornings, that's a time that we will either do programs like Journal Club and the Orthodontic conferences. Tuesdays are a general seminar sort of exercise where we cover a whole range of different topics in oral and maxillofacial surgery according to certain blocks. On Thursday is kind of a mix-up day where we do, on certain occasions, we will do path conferences. Other days we'll do case-based series presentations, and we also do our M&M conferences on Thursday morning. Now, because again, we have a significant number of faculty, we are also able to offer what we call split level seminars, because we recognized some time ago that in certain topics, for instance, once a chief resident has actually gone through the lectures in his or her early years, there was probably no need to repeat those lectures for them, as they became more senior. So this is what we do, is that we have large conferences for everybody when there are topics that have not been covered before, but when the chief residents have already listened to certain things, like for instance in the orthodontic conference, we don't necessarily have to keep repeating, over and over how a patient is worked up. So when that happens, then we will split the group into two, and we will have the senior residents do a focus meeting in areas that are more pertain to their level of training and education, whereas the junior residents can have a conference that suits their level of training. So we have, in addition to all the conferences that we mentioned before, there's a formal physical diagnosis course, which all the four-year residents will do. We have practice management seminars that we conduct at different times of the year. Residents will get to attend the national meeting at least once during their residency. If they have presentations and all accepted, they may go additional times. Every year we have a meeting called the Hines Symposium that we host here in Houston. It is now turned into the largest regional meeting in the Southwest, and is typically a symposium that is focused on private practice topics. And we do that annually every year. There is also a board review course that all third and fifth year residents will be sent on. And traditionally, we have attended the board review course in New Orleans, conducted by LSU. And every year as well, we do run a trauma bridge fixation course, which we do in conjunction with our plastics and ENT colleagues. Resident monitoring. So, as the residents progress through the program itself, you are going to have periodic evaluations done by different individuals. So certainly once you finish a rotation, the service chiefs will sit down with you and discuss, your performance at the end of that particular rotation. All of those reports then will be compiled on an online sort of recording format that you will have full access to as well. Now, I will meet with every resident in the program, whether you're in medical school or whether you're on service, wherever. I'll meet with you twice a year. We tend to have a mid-year evaluation sometime in the November-December timeframe, and then we have one in the May-June timeframe. Now, during my evaluations with you, there are two different things that we will be looking at. So we have, as all residents do in the country, a surgical log. Now, unlike most other programs in the country, we do not use the DDS for DDS program, but we use a proprietary program that has been developed, specifically for our Houston program. And there are a number of different reasons for us to do that, but part of it is because data collection is very important to us. So the resident surgical log will be one component of the evaluation process. The second component is really sort of analogous to the resident surgical log, and it's something that we call the learning portfolio. And the learning portfolio is basically the entire syllabus of oral and maxillofacial surgery that we have broken into different modules. And in each of these different modules, we basically list out all the different topics, we provide references. And because there is so much to learn during the course of the residency, we try to stratify it so that people are not overwhelmed, through the different years. So, we try to summarize, different things that a resident should be able to have learned at the end of their first year, and then similarly at the end of their second year, so on and so forth. But, rather than listing out everything that we could possibly have in the specialty itself, which can be really overwhelming, we try to provide some guidance by giving some stratification to the learning process. So these two things, the learning portfolio and the surgical log, are things that the program director will review with the individual residents. The OMSITE in-service training exam is obviously something that we use, and we do actually place some emphasis on this because it gives us a sense as to what our residents' didactic knowledge base is like. And usually we find that there is a correlation between, how well people do in the OMSITE and also how well they are doing as residents as a whole. Now you can see over here, in green are all the first year residents in the group, and then the red and the purple are all the senior residents in the group. And so, we like to see this progression up here, but we also like to see that all the chief residents and all will be up here in this type of score range. So this gives us a sense and gives us some sort of validation that the learning process that we have put in place is actually working out. So, as you could see from the medical center itself, we have a very, very large program, and it is very, very clinically active. And, the level of activity can be summarized over here by looking at these case log summaries from the last few years. So I've actually given you 6 years worth of data over here because, you can see then it's not just a one-off sort of item. In this column over here are the CODA requirements. And the CODA requirements for 6 residents a year essentially mean that we have to do roughly 60 trauma cases, 60 pathology cases, 60 orthodontic, 60 reconstruction cases, and 600 cases of anesthesia. You'll see that the numbers that are actually being generated by the program, are way in excess of that. And they're also fairly consistent. So you'll see that in trauma, this last year itself, we actually saw a huge jump in numbers, 836. That coincides also with the fact that Memorial Hermann Hospital, which I pointed out earlier to you, for the last 3 years now has become the busiest trauma center in the United States, surpassing Maryland Shock Trauma. We do about, 530 pathology cases. So this includes our malignancy service. Orthodontics, we had 579 cases. A number of these cases are actually done in conjunction with one of our former faculty members who's in private practice at Methodist Hospital, but our residents still rotate with him, for a full 2 months. And so they gain a lot of experience there. There's about reconstruction and cosmetic cases. Last year, we recorded 358 cases. And as far as anesthesia is concerned, the numbers are still very significant, over 2,225 cases. So, if you want to get a sense roughly, what each graduating chief is doing, if you take these numbers and you divide them by 6, and that's the approximate number that each of the chiefs is graduating. So this year was meant to have been our site visit. Site visits are done on a 5-year cycle. Of course, our site visit fell right in the middle of the COVID shutdown, and so it was deferred to next year. So we'll have to see what format that takes. Now, residents, when they're in the program itself, even when they are on their MD track, we do continue to provide them with a partial stipend, even though they're not they aren't active with the residency program. And so roughly these are the numbers, that you can expect to see when you are in medical school. So the medical school tuition, for MS2, MS3, and MS4 is between $22,000 and $23,000. And during this time period itself, we provide you a stipend with close on, probably 70% of the med school tuition. It doesn't cover it entirely. And this is provided as a scholarship of some sort. In addition, whilst you are in medical school, the program will also continue to cover your health insurance costs for you and your spouse. For residents on the 4-year program, then there is no spinoff. So your stipend, is, and the current range of stipends for PGY1 to PGY4, can be seen over here on this slide. So, Houston, fortunately for all of us, has a very, very low cost of living. Housing costs are low, and of course, just the general costs of groceries and commodities and everything else is also inexpensive. And so that's why, the resident stipend, can go a long way in the big picture itself. Okay, so I'm going to finish off with this slide here just to try to explain a little bit of what we anticipate is going to be our COVID interview process. So our deadline for interviews will close at the end of September, after which time we will be selecting individuals to invite to interview. Now, in the past, these would have been invitations for in-person interviews. But, this year, because of the pandemic, we will be conducting our interviews virtually. However, I do put up here that there is an in-person visit option. So for those candidates, who would like to come and visit Houston in person, we will certainly entertain your requests. And so you will need to then just reach out to us, and we will organize, something along those lines. And if there are enough people, we will try to group them together on certain dates, to facilitate the process. But otherwise, the interviews will be done virtually. And we will probably be using one of these types of programs, either WebEx or Zoom or something like that, to conduct the interviews. Before the interviews itself, we will provide all candidates, with a sort of pre-interview summary of the program, similar to this particular talk here, but we may actually post up additional information and post them up in downloadable PDF format so that people can look at things like the curriculum if they want in detail, or look at the organization of the program, in terms of the different years and the different rotations that they go on. So all that information will be provided in a pre-interview website. And this is also an area where we hope to complete a video that summarizes and showcases the program, something that we're actively working on right now. The interviews will probably be conducted over 4 to 5 different days. And each candidate, will be assigned 1 day to do their interviews. The interviews will really have 3 different types of formats. There'll be a one-on-one interview with myself, which will last approximately 15 minutes or so. And then there'll be an interview with a panel of faculty members. So we will have 2 panels, but each candidate will only interview with one particular panel. And that interview goes for a little bit longer. We anticipate it to be about 30 minutes in length. And there'll be probably somewhere in the region of between 3 and 5 people on each panel. So during the panel discussion, the format that we tend to use there is an evaluation of behavioral characteristics and situational responses. So it's not an interview in which people are going to sit there and ask you about Krebs cycle or ask you to discuss, the anatomical relationships of the facial nerve or anything like that. But it's more an effort for us to try to get to know you better in a in this kind of a video sort of format, And also for us to gain a sense, as to trying to understand how you think. And so some examples of situational, questions and responses are, things like, well, can you think of an example when you told a lie? Or how would you handle a situation where you were lied to? So questions like this, obviously, there is no preparation for them, but it does give us some insight as to the thought process of the individual. So in addition to the interview with me, the interview with the panel, we will then also offer a sort of an open virtual, room where we will have a number of residents populate the room during the course of the day. So, in between your interviews, whilst you're waiting, to say interview with one of the panels or interview with me or something, we will have an open a room where you and others can all join in and either, ask questions or listen to discussions that might already be taking place. We'll ask the residents also to try to prepare some material that they can show. So during the course of that time, they might be able to give you additional perspectives to the program. But if you have some very specific questions you would like to ask, of the residents, this is a good opportunity to do so. So that summarizes the COVID interview process that we hope to conduct, and I hope it's clear to you. Okay. All right, so that's pretty much all that I have for you in terms of this particular presentation. If you have any additional questions, I would encourage you to reach out to us. You can do so by either emailing Kenny Allen or myself. We will put our contact information on the virtual website, so you'll be able to use that to get into contact with any one of us if you need to. Otherwise, as you are going through your 4th year and final year of dental school in this new kind of COVID era, I wish you all the best of luck. And I hope that the interviews go very smoothly for you as well. Thank you.